Hi, everyone. My name is Hiral Shukla. I'm an outreach coordinator for Cancer Support Community, Central New Jersey. We're located in Bedminster, New Jersey, and we're bringing the Summer Health Series. And today's topic is finding reliable health information you can trust online. Um, Here we have Allie Blumenfeld and Nancy Birkenfield. They're the librarians at Elizabeth Public Library. And I will hand it over to Allie.
Thank you. So Nancy and I are librarians at Elizabeth Public Library, but we are also consumer health information specialists. We got a special certification from the National Network of Libraries of Medicine, Middle Atlantic region. And that means that we've had some additional training in how to provide reliable health information in print and online. So a lot of what is going to follow in this presentation comes from our training that we had, and it's information that we share with our patrons here at the library and that we're delighted to share with you and the clients that you might serve, or anyone that you want to share this information with. The slides and the resource guide that we created are going to be freely available, so they'll be sent to you as well, so feel free to use them and share them. And as always, you can contact Nancy and me at the Elizabeth Library if you have any questions, and our contact information will be shared later. So all of us search for health information online. I do it, everyone I know does it. And it's not a bad thing that we want to be informed about our health and that we want to find answers when we're struggling with symptoms, or if we just got a diagnosis from our doctor and want to find more information. It's good that we have this information available to us. The problem is that not all health websites are created equal, and we have to be aware that sometimes the information that we're receiving is actually not created with the intent to help us, but rather to sell something, or it's just not useful or good information. So this presentation is going to show you some ways to search for health information as well as evaluate the health information that you are receiving. We usually begin our searches in Google. And just keep in mind, when I say Google, I'm talking about any search engine, whether you use Yahoo or DuckDuckGo. I'm just using Google as shorthand here. But we normally start at Google or a search engine when we want to begin a search. And it's no different with health topics. What I'm going to show you is some websites that you can use to start your search. So rather than beginning in Google, you might start on these websites. And that way you know the information that you're getting is already from a trusted source. But if you do begin your search in Google, it's important to choose the right websites to click on. So within the results, you'll see advertisements, or you'll see websites that aren't trustworthy. So how do we find out if one of these websites is trustworthy or not? These are some questions that you can ask. You want to know who runs the site. So whether it's easy or hard to find, the About section of the website is important to note. If it's a reputable source, you should be able to find it no problem. In fact, it should be right at the top, who we are, which organization runs it, which doctors run it, and where the information is from. It should be easy to find. If it's not, that should raise a red flag, because it's important for websites, especially that are providing health information, to have transparency. And on that note, who pays for the site? Is it a for-profit organization or a non-profit organization? Maybe it's a government website. Maybe it's a hospital website. So it's good to know who's running it and who pays for it. Is the site trying to sell you something? And that also ties in with the last bullet point here. When you're reading an article about health, are you actually reading a news article or maybe a bit of advertising? It's important to know if you're being sold to, because then the information that's being provided to you isn't with the intent to really help you. It's with the intent for you to buy a product. And so that is going to change the focus of the information, and it may not be the best for you. If it's an unbiased source that's just providing facts, then that's really what we want to look for. We want to ask, where does the information come from? Is the information reviewed by experts? Does the person who wrote it, are they a doctor, or is it just maybe a writer, or is it a hospital team? Has it been reviewed by doctors? Is the information up to date? A lot of the time, health information changes, and it changes rapidly. So we want to make sure that the information we're getting is current. And does it ask you for your personal information? So these sorts of websites should not be asking you for personal information. And if they do, again, that should raise a red flag. Reputable sites will exist for the purpose of providing this information to you for free. And they shouldn't be collecting any information about you or trying to sell you anything. So beyond Google, where can we begin our search? These are 3 of my favorite websites to use. Medline Plus, which is a government website, NIH, which comes from the US National Institutes of Health, and the Mayo Clinic, which is an example of a non-governmental website, but one that I still trust because I trust the Mayo Clinic, which is a nationally and internationally recognized health institution here in the United States that's nonprofit. So when you begin your search for a symptom or a diagnosis or a treatment or even a medication or supplement on one of these websites, you know that all the information you're receiving comes from these sources. So you're not going to get advertisements, you're not going to get false information, and no one's selling you anything. So that's why it's good to begin your search here. And just like sometimes we get second opinions, feel free to check all 3. Right? So if there's one that you like better, that's fine. But it's never a bad idea to go down the list and do the same search 3 times and see what information you get. So I'm going to take you through these now just to get a brief look. And Nancy, who's also here, will point out some features that she likes on these websites as well. So this is Medline Plus. I find this one very user-friendly, very easy to use. And you can see on the homepage on the left-hand side that you can search for health topics. You can search for drugs or supplements. You can find videos and tools. And so when you're looking for just a symptom, if you're looking for a condition or a disease, you can start with the health topics and they'll show you a list you can browse, or you can just search up here at the search bar. So I'm just going to run a quick search as an example. So when I search for diabetes, it brings me this summary up at the top. But you can see that the list here, it looks like Google. It looks like when we run a regular search. These are the sort of things we get. We get the title of the article, a few words about it, and a link. But again, the good thing here is that everything on this list is right here in Medline Plus. So everything you click on, it's not going to take you to a new website. It'll be right here within Medline Plus. And you know that everything you click here is trustworthy. So I'm just going to click on the first link for a basic overview of diabetes. You can see that there's a summary, there's information about diagnosis and tests, different treatments. There's all sorts of articles here on different topics related to diabetes, including videos. And it also gives you some fact sheets and some additional resources to check out, like the American Diabetes Association. So it's more than just, I want to know what diabetes is, here's the answer. It actually provides you with so much more than that. And you know that everything here is trustworthy. So going back to the homepage, Nancy, is there anything you want to share here?
What I like to share is like one of my favorite features. I'm having trouble scrolling down. Is that Medline Plus is also available in multiple languages and also has things like healthy recipes. Down here, there are extra sources that you can go to, easy to read materials. Let's say you wanted to explore further information, you can go to a specific organization that that is specific to that particular disease or ailment. And if you also notice, this is my favorite feature, is health information in multiple languages. So if we were to click on that, you will see all the languages that this is available in. And just let's go down and let's click on Haitian Creole. And let's click on D for diabetes. That's it. Okay, let's scroll up to something that's, okay. Here it is. Let's just scroll up just one more. I just saw, okay, over here, coping with disasters. You have an English PDF, you have a Haitian Creole PDF, be a printed document, but if you click on MP3, you can actually hear what the
Helping your child after a natural disaster. Haitian Creole. Comment pour aider ti moun après un désastre naturel?
And I think that's really helpful because everybody likes to get their information in different ways. Some people like to hear it, some people like to see it. So this is one way that you can see it and you can also hear it. So you really can get to access to the information.
There's so many languages to choose from.
Yes.
And like Nancy said, you can access fact sheets for different health topics and also audio. So someone reading it to you, if someone has better listening comprehension in a different language rather than reading comprehension. And so unfortunately, the whole website isn't translatable in any other language but English and Spanish. So if you speak a language other than those two, that would be the best place to go, is at the bottom of the page, health information in multiple languages. But back up at the top, on the right, it says Espanol, and then the entire page is translated into Spanish. So all of the resources that we talked about, all the articles are in Spanish. So we'll just go back and yeah, so this is probably our favorite one, right, Nancy?
It is. And if you also scroll down, you can see clinical trials. If you're looking for a clinical trial, if
that's down here.
Updated information on a regular basis, you can subscribe to the NIH Medline Plus magazine, which is free. You can get that delivered right to you. So you can see there's a lot of information. If you want to know how to eat healthy, there's recipes. And this is my first place I go to when I need anything medical. I just love Medline.
Yeah, and we're not paid to say that. So I'm just going to close that back up and head back in here. So the next one that we'll check out is nih.gov. The NIH is a huge organization. So when you get on this page, there's a lot more than just searching for health information. They also have information on grants, news and events, research. But for just the person who's looking for health information, we're just going to click here where it says health information. And they have different resources here. They have a link to healthcare.gov, talking to your doctor, an A to Z list, finding community resources. But there's also just a search bar right here. So the difference is searching right here will search just in health topics, but the bar up here on the home page will search the entire website. So the best place to go will be here, search health topics. So we're just going to run the same search so you can see the similarities and differences. So similarly to Medline, there's a list that looks a lot like a list when you search on a regular search engine. But again, everything here that shows up is from NIH. There's the NIH Institute of Aging. There's a lot of different institutes within NIH. So you might see the website that you go to has that subtitle, but they're all from NIH, so you know that you can trust it. For example, this one is from the National Institute of Diabetes and Digestive and Kidney Diseases, but it's still under the umbrella of NIH. Here you have your summary. You have more topics, you have basics such as symptoms, treatment, managing the illness, and preventing problems caused by the illness. So this is a very easy to look at, very attractive page where you can find all sorts of information about the topic. So not only is this more trustworthy than a regular site you might find elsewhere, it really is, it's more comprehensive, in fact. So we're going to go back to the homepage. Is there anything you want to add about NIH, Nancy?
No, you covered it. I just...
Okay. There's also wellness toolkits, which is very simple on different topics, different simple toolkits with information about the topics you see here. So they're really trying to provide information in a, in an attractive way. So it's helpful information to share.
And I also want to say about these websites, they're just not about diseases or symptoms. They're about all around wellness. So if you want to explore alternative, therapies, you want to explore aromatherapy, acupuncture, yoga for health. They also have everything that has to do with keeping you healthy and wellness.
That's a good point. And the last one that we'll share is Mayo Clinic. So Mayo Clinic, sorry, I'm not sure why this is showing up. Never mind. Not sure why that didn't show up. But in the interest of time, I'll just talk about it for now. Mayo Clinic is run by the Mayo Clinic, and they are a really trustworthy health organization and medical center here in the United States. So the information that they provide has been reviewed by doctors, and you know that you're getting good information. And similarly to NIH, you want to make sure that you're not just searching the entire website, which has information for patients and doctors, but just the health information section. I'm sorry, I wish I could show it to you, but definitely poke around, and if you need any help with it, feel free to contact us. But it's an easy site to get around, and again, it just offers really good health information for you to search. And now another aspect of health information online is research. So people might research health information. If I'm at home and I'm feeling sick and I have a symptom, I might look up information, but I wouldn't call that research. When you're really doing research, you're looking up articles from medical journals that are giving you the latest up-to-date information about new discoveries in the medical field pertaining to that illness or condition. So a lot of people who are recently diagnosed with something, and maybe the doctor offers them different types of treatment, they might use one of these resources, PubMed or NIH, to look up different treatment options, either for themselves or for someone that they're caring for. So it's good to research the latest treatments or therapies as you weigh your health options, or to find the efficacy of new treatments, medications, or even supplements. So I'm just going to show you PubMed, which is a good place to start your search. It's the free public-facing database version of Medline, not to be confused with Medline Plus, which I showed you. But Medline is something that's usually available to researchers or practitioners. So your doctor might be using Medline to look up studies and better choose which treatments to follow for you. So when you look at PubMed, you're looking at a version of that, right? So it's not everything that your doctor can access, but it's definitely up-to-date and trustworthy, peer-reviewed articles that are about the health topic you're looking at. So we'll go to PubMed, and you would just search here. And Nancy, was there something you wanted to share about?
Yes, if you just do a search, and I'd like to.
What do you want me to search?
You can do diabetes. That's
Okay,
it.
that'll be our search of the day.
If you notice along the side here, you have multiple filters. If you want to limit it to a specific date, you can either use the slide bar, or you can scroll down and check off the box that says 1 year, 5 years. The best way to search this database to make sure that you pull up free articles. Not every article in this database is free, and not all of them are full text. So to make sure that you get free full text, click on the free full text box.
That will automatically change the results that have already come up.
Yes,
and everything you see will be a free full text article, not just the abstract, which is a summary, and not an article that you'll come up against a paywall.
And because the square is covering it, if you notice, here's a free article. And it's in Spanish. So if you click on the second article, you see that it's available free text in Medicina. Before you click on that, if you scroll down, you will get the abstract, which is in English. It will give you similar articles. And if you scroll back up and you click on full text Medicina, you will get the full text of that article for free in Spanish.
Not all of the articles will be available in Spanish, but you'll be able to see it, as Nancy pointed out, right next to where it says free article. It'll say the language that it's in.
So, and this is one way to make sure that you're getting a complete article.
Right. So.
And I just want to reiterate the previous slide that had our contact information. If you have any questions about these databases or how to search these sites, please reach out to Allie or reach out to me. We are more than glad to walk you through it and to help you with your search and to help you find the exact health information that you need, whether you're looking for alternative, you're looking for exercises for sciatica, or you're looking for a specific illness or a clinical trial. We're here to help you, and we want to help you.
Definitely. You don't have to be an Elizabeth resident to get help from the Elizabeth Public Library. We don't ask you where you live. If you call us or email us, we're happy to help. So as Nancy pointed out, our email information is right on the screen. This is how you can contact both Nancy and me. So we'll move on. There are a few more resources that'll help you in evaluating for yourself what health information is best for you. And these are provided by our friends at Medline Plus and NIH. So I'm just going to show you a few of them. This is a whole tutorial by Medline Plus on evaluating internet health information. So this is really helpful. You start the tutorial and it takes you through how to look at websites and judge for yourself. Where does the information come from? And is this information right for me? And the reason why it's important for you to be well-versed in this is because, when you go to the doctor and you are asking about a symptom, your doctor has your chart in front of you and they know your medical history. So they are going to give you information that's best for you. When we search online, we're not getting that sort of care. We're looking at information that's written for everybody. So it's important, just as a note, that even though we're finding and evaluating good health information resources, to always follow up with your doctor. And it's never a bad idea to come to your doctor with good information. You want to show that you are finding good information, you're taking charge of your health, and you're really opening a dialogue with your doctor to discuss what you found. But keeping in mind that your doctor, again, has your full medical history. These websites are just for everybody. So something that you might search, you might say, oh my goodness, is that what I have? It may not be so. You definitely want to follow up with your doctor. And the next one is an article from the National Institute on Aging. And it's just another helpful guide to determining if health information is reliable. So this is the next step after this presentation. If you want to learn more, these are good places to start. And lastly, we created a resource guide for you. This is publicly available on Google Docs. Nancy and I put this together, and it includes the links to the websites that we went over today, in addition to some more. And we also have links to research and fact sheets in addition to just the websites where you would search for health information, and then more links to websites that will help you in evaluating health information. So this is something that you can always refer to, share with your clients or friends or family, and it's a living document, so we'll be updating it as we find new reliable health websites for you. So definitely save it. And that brings us to the end. Thank you so much for tuning in. If you have any questions, again, please feel free to contact Nancy and me. We're so happy to help, and best of luck on your journey to finding good health information for you and your family. And thanks, Nancy, for being here with me. Thanks, Hiral, for hosting us.
Thank you. I want to stop the recording on your end, Ellie.
Yeah.